Uh, Good morning to doctor. So our topic for today is emerging and re-emerging parasitic infections. So I'm joined by my few group members, which is Harini, Kamalish, Kosiraj, and Shenhua. Okay, so basically, what does emerging and re-emerging mean? So emerging means that a disease that is new, that appears newly in a population. Then re-emerging infections, they are diseases that have been overcome, but they return to the population. So there are a few factors for the re-emerging, for the emerging and re-emerging of diseases. So the first one would be environmental changes. So it's like maybe the environment goes worse, like pollution and such. So maybe that encourages the parasite to further thrive in the population. Then you have urbanization and or migration. So urbanization means that people move into a more populated area. So maybe that will affect the frequency of the infectious diseases. And then from migration, people might migrate and bring the diseases from one place to another. And then we have genetic mutation. So in genetic mutation, we might see certain parasites behaving abnormally as they are not mutated forms. They will be more docile and such. And then we have travel and trade, which is almost similar to migration, where the parasite gets transferred from one place to another. And then we have vector or reservoir changes. So what this means is that the way the parasite transfers from one organism to another, if this fact changes, it might mean a more prominent infection in a population. And then you have drug resistance. So the parasite may develop certain resistance to our treatment methods that involves drugs, anti-parasitic drugs. So that's it for me. So I move on to the next slide.
Now I'll be presenting about five important emerging parasitic infections that are becoming more common in new regions due to factors like climate change, poor sanitation, and also global travel. So first we have babesiosis, so which is caused by babesia species and transmitted through ticks. Due to warming climates, tick populations are spreading to new areas, increasing the tick infection risk of infection. And the symptoms includes fever, fatigue, and hemolytic anemia, and also which means the destructions of red blood cell. And next up is cryptosporidiasis, which is caused by cryptosporidium and spread through contaminated water. And it's often linked to large waterborne outbreaks, especially after floods or when sanitation is poor. And it mainly causes diarrhea and is especially dangerous for immunocompromised individuals. And we also got angiostrongyliosis, which is caused by Angiostrongylus cantonensis, and also known as a rat lungworm. And this infection occurs due to by eating or raw or undercooked snails, slugs, or contaminated vegetables. And it can lead to serious brain infections, particularly in tropical and subtropical regions. And next slide. And next up, we got malaria. Even though malaria is well known, it's now emerging in new areas when it wasn't seen before. And it is caused by Plasmodium species and spread by Anopheles mosquitoes. And due to climate change, travel, and displacement, previously malaria-free zones are now at risk of local transmission. And lastly, we have leishmaniasis is caused by leishmania parasites and spread by sandflies. And it is spreading into non-endemic regions because of migration, urbanization, also adaptation of sandfly vector. And the disease can now show as a skin ulcers, or in more severe cases, it also affects the internal organs. And that's all from me. Thank you for listening.
So now we will discuss about the re-emerging parasitic infection. So these re-emerging parasitic infections are diseases that were previously declining in incidence, but now it is increasing again. So this can happen in areas where control efforts like insecticide spraying, improved sanitation, or access to medication have been weakened or stopped. So the first example is resurgence of malaria. So this malaria is commonly caused by Plasmodium parasites. So although the global efforts and had reduced the malaria cases significantly, it's now reappearing in regions where mosquito control efforts like insecticide spraying and the use of bed nets have been disrupted. So it is coming back because the drug resistance is making the treatment less effective, and the political and economic instability is limiting our healthcare access and disrupting the health programs. So next is Chagas disease, which is caused by Trypanosoma cruzi. It was traditionally spread by triatomine bugs, also known as kissing bugs, in poor and rural areas, but now it's spreading in urban areas too. So it normally transmit through blood transfusions, organ transplants, and congenital transmission. So this urban transmission is a new challenge, and it highlights the importance of screening blood and organ donors for parasites, not just bacteria or viruses. Next slide, please. So the third example is schistosomiasis, a waterborne disease caused by Schistosoma species. So it literally spreads when people come into contact with fresh water contaminated with larval forms of the parasite, which will be released by infected snails. So it is re-emerging because the construction of dams and irrigation systems create more habitats for snails. And due to the increasement or increased exposure in communities living near such water sources. And lastly, we have toxoplasmosis caused by Toxoplasma gondii. So it mainly transmit by eating undercooked meat, drinking contaminated water, contact with cat feces, since cats are the definitive foes. So the re-emergence of toxoplasmosis is linked to changes in animal populations, farming practices, and environmental contamination. Outbreaks has been reported after floods, which due to spread in contaminated soil and water. That's all from me. Thank you.
So one of the major challenges in controlling parasitic diseases is in diagnosis. Across the world, many regions still rely on outdated microscopy techniques that lack sensitivity and specificity. Although advanced diagnostic tools like PCR and ELISA exist, but they are often inaccessible due to cost, infrastructure limitations, or they are prone to false positive caused by cross-reactivity. And this diagnostic gap not only delays treatment, but they also impairs effective disease surveillance. And treatment presents another significant hurdle because drug resistance among parasites is growing steadily, but investment in new parasitic compounds remains minimal. Even when treatments are available, the affordability and adverse side effects limit both access and patient adherence. Next, control and surveillance efforts also face critical weaknesses. Underreporting, geographical blind spots, and insufficient funding reduce the ability to accurately monitor and contain the outbreaks. And without robust data and rapid response systems, parasitic disease can spread unchecked, especially in unstable regions. Next slide. Okay, now let's examine the recent resurgence of malaria in Venezuela, and it is a crisis shaped by both environmental and systemic factors. The collapse of Venezuela's public health infrastructure has left large gaps in healthcare and prevention efforts. And compounding the problem, illegal gold mining operations have created ideal mosquito breeding grounds while limiting access to proper diagnosis and treatment. These conditions intensified local transmission and lay the foundations for a broader epidemic. What began as a localized outbreak has rapidly escalated due to the movements of migrant workers and facilitating cross-border spread into neighboring countries like Brazil and Colombia. Migration and transmission maps, as shown in my slide, highlight how quickly vector-borne diseases can proliferate under unstable conditions. That's all for me. Thank you.
Now we look into the treatment and control. Firstly, we have vector control strategies. This involves measures like targeted insecticide applications, such as mosquito spraying and using large size to animate the breeding sites. We also need to focus on the environmental modifications like draining the standing water properly and promoting personal hygiene and protective measures such as using repellents and protective clothes. Secondly, we have screening and monitoring method, which is a very crucial method in early detection and diagnosis. We also do this through active and passive surveillance for the disease like BBSs, we have mentioned just now, as well as conducting blood banking, screening, and monitoring the water and food safety. Thirdly, we have community education, which is vital in our community to empower the public knowledge on the emerging diseases. We can achieve this through by promoting proper hygiene in the community as well as sanitation. This will raise the awareness on symptoms and engaging community in the broader control effect to prevent the spreading of this disease. Next slide. Okay, to conclude all of our presentation today, the dynamic of the nature parasitic infection remarked by both emerging and re-emerging threats. So let's look into how future biomedical scientists could include themselves in it. This presents in a significant opportunity for future biomedical scientists. Our contribution in developing the advanced diagnostic methods and strengthening the global surveillance system, and by innovating the research into parasites and its biology behind it are very crucial for the future generations. Also, it's sustained and interdisciplinary collaboration across a field like parasite biology and vaccine development technology will be paramount in effectively impact on these enduring and adapting parasitic threats on the global public health. That's all from us. Thank you.